Well, good evening, everybody. How the heck are ya? It's been a week. I apologize for getting wasted ass drunk on Sunday and missing the stream, but it happens. It happens to the best of us. But it's good to be here. It's good to be back. Here we go. This is going to be an interesting evening. Not Dr. Brian. What's going on, man? How are ya? What's going on? I guess I should do that. Hello. How's it going, dude? You had a good week so far? Leche lad, excellent, excellent. Dre, what's going on, man? So be warned, I this is the first time I will be streaming with the Invenc codec instead of my CPU. Oh, thank you for the Prime sub, dude. Very cool. Appreciate that. Really appreciate that. It's super cool. But yeah, my bitrate right now is actually dog shit. So if the stream seems terrible, I'll just restart it and use the CPU instead of the GPU. But we're seeing how this goes. So yeah, if quality suffers, holler at me and we'll fix it. But anyway, yeah, this has been a good week for me. I hope all you guys are having a good time. My wife's birthday was last week, and we celebrated this weekend. We went to this badass place called the Mercury Room. I think I mentioned it previously. Oh, I need to. That's the whole point that I'm here is getting on this. Share my screen. There we go. But yeah, Mercury Room, totally cool, man. Yeah, Nvenc is causing some lag. Maybe I'll see if I can switch it on the fly. I don't know if I can. Oh, don't think I can. good food, even though they're out of prime rib. My friend and I ordered prime rib, and like it was kind of like a double date. My wife and his wife both had birthdays within like 3 days of each other, so we just kind of did a tag team thing. And yeah, we both ordered prime rib and they didn't have any, so that sucked. But it's okay. It's all right. We had what did we have? A hanger steak? Yeah, a hanger steak instead. That was fantastic. In other news, I fired up the smoker for the first time this year. Hey Josh, what's going on, dude? I love tag team double dates. I bet you do. I bet you do. Hey, apologies for the shitty video tonight. I'm not really sure what's going on. My bitrate is just terrible. I thought it was the Invent codec that I was using for the first time, but it wasn't that. I think it's just Twitch, maybe. Twitch does this from time to time, has a freaking seizure. But, oh well. Apparently the audio is okay, so it's all good. Oh, I just looked at this Discord here. There's a whole bunch of different info regarding the case that we're going to talk about tonight. Oh, maybe that's a different case, because she was not a med tech. YouTube is lagging, so you don't know? Oh, well, maybe it's me then. Might be Google Fiber having a seizure for some reason. Bummer, dude. Big time bummer. Oh well. Yeah, anyway, I fired up the smoker. It was delicious. Made some ribs. Smoked some beans. Is Google Fiber free? No, but apparently it should be. It's not very expensive. It's I think it's $70 a month for a gig, up and down. Not too bad. Could be worse for sure. But yeah, Google Fiber just changed. Expensive as hell for a gig? I don't know. Is it? Doesn't seem that expensive. But they also give you a couple. Oh, what the hell? Apparently, I'm just now streaming. Uh, yeah, they give you a couple like Wi-Fi points, but I already had a mesh network set up in my house anyway, so that didn't really change anything for me. But yeah, it's actually pretty good service most of the time, especially where internet's concerned. Except for when I want to talk about a pretty important topic on stream. It's not doing me any favors. But oh well. And they recently changed away from having TV service, so like Google Fiber doesn't offer its own TV service anymore. They make you buy YouTube TV, which honestly sort of makes sense. Like, why would Google have two separate TV services? That just doesn't really make sense. But that actually lowered our bill by a shitload because we used to have to pay for each of our TV boxes. We have like 6 TVs, so like now we don't have to do that at all. We just get YouTube TV everywhere, and life is good. So yeah, that's been my week in a nutshell. Got way too drunk on multiple occasions over the weekend. Ate way too much food. Yeah, we have 6 TVs. We do. We do indeed. And my computer. And actually, we have another. My wife has a computer up on our third floor too. This is the article you linked. Nice. Yeah. I think I actually just saw that from you. Daddy Mel, what's going on, man? How are you? Move that over there. Yeah. So this is a different case, right? Pablo took all his meds. Yeah. This is not RaDonda Vaught, right? Yeah. Okay, that's a different point. It's not Vaught, but it did some docs removed. Let's see. I can scroll up. Yeah. I see this. Is this what you're talking about? I think I've seen that actually. Oh, it's so tiny. So tiny. All right. Well, shall we get? Speaking of RaDonda Vaught, shall we get to that? Let's just dive right in. You just reposted the originals. Okay. Beautiful. Thank you very much for that. Oh, you gotta be fucking kidding me. How can I make this bigger? Boop, 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 boop. This is very long. All right, so if anybody is unfamiliar with this case, so RaDonda Vaught is a nurse, was a nurse at Vanderbilt Hospital. Don't have any idea what that hospital is actually called. Um, she was recently convicted of, I believe, criminal negligence, um, as well as something else, and I can't recall what that was. Like neglect of an incapacitated person, I believe, is what it was called. Something near that. In any event, we should lay a baseline for this. So there are tons of people worried about the implications of this case. So there's kind of one side, which is like people, just normal people worried that, you know, they're going to go to the hospital and somebody's going to kill them. And two, which is probably the more significant population, are healthcare workers worried that this sets a precedent where a medical error can be, like essentially freely charged as a criminal offense. And we'll address both of those things as we go. But so let's lay the groundwork for what exactly happened here. So there's a pretty good article in the Tennessean that rounds up roughly what happens. So, RaDonda Vaught was a, you know, relatively new nurse, but she'd been working for 2 years. She, you know, was experienced, at least. Not a lifetime veteran or anything, but she knew what she was doing. So, Charlene Murphy was the victim. She got, here, I'll make this bigger so you guys can see it. She got admitted on Christmas Eve of 2017 with what we call a subdural hematoma, which is basically a brain bleed. I couldn't find anywhere what caused that. The chances of that mattering are pretty slim, but I was interested anyway. So she checks in. Apparently it's not super bad because on the 26th, they're thinking of discharging her, and that's like a very fast turnaround for a subdural bleed. So I think she was admitted with, kind of like stroke-like symptoms, like she was having slurred speech and weakness and things like that, and her family brought her in and she got evaluated, and like she evidently recovered very quickly. But anyway, she was getting a follow-up scan, and I honestly do not know if this was like a CT or an MRI. It's probably a CT, and you know, just sort of to make sure that there's no new bleeding or anything changing. It was a PET scan. So I heard that it was a PET scan, but that doesn't make any fucking sense, because a PET scan is like, it's like basically something used for, like determining if cancer is metastasized, because it's really good at visualizing like cellular uptake of certain chemicals, basically. That's what she said in her TBI police statement? Okay, well. Alright, we'll go with it. So it was a PET scan, which is really weird, as I'm pretty sure that I've never seen anybody who is not a cancer patient get a PET scan, but maybe there's some, like, weird fringe use for PET scans in head injury or, like, brain bleed patients that I'm unaware of. But anyway, she's going to radiology for a scan, and she is claustrophobic. And lots of the, you know, like CTs, MRIs, things like that involve you being in a tube for some amount of time. MRIs, generally a big amount of time. CTs are like literally a minute. But still, people freak out with that. So, can I wave to the camera? Waving. Hello. Yeah, the bit rate is still trash, so I'm sure the video is crap. That is very unfortunate. Is it still shitty video? I'm sure it is. Anyway. Yeah, how lag is still there. Okay, bummer. So some doctor prescribes her Versed, which is a sedative. The generic name is midazolam. And they get her to the scan, and everything's cool. However, everything's not actually cool because her nurse, who was RaDonda Vaught, or one of her nurses, gave her a medicine called Vacuonium instead, which is a paralytic that really pretty much is only used in anesthesia. Occasionally used in ICUs to keep people who are intubated, like, still. But for the most part, it's an anesthesia drug. And it lasts a long time. So if you get that, you're paralyzed for like 30 to 40 minutes. And she got a big dose of it too. So, as this states, the drug leaves her brain dead because she had an anoxic brain injury and suffocated, basically, while she was getting this scan. So, they disconnected her from a breathing machine. I'm not sure why they even did that, honestly. I think that was just for show, because she was probably way dead at the time anyway. And then there's, like, some confusion afterwards because the coroner determined that her death was because of her brain bleed, which is very confusing. And then kind of the rest is history, honestly. So what happened is, like, she apologized and acknowledged her error and reported it, and Vanderbilt essentially kept it under wraps and didn't report it, like, appropriately. And eventually, CMS, which is the Center for Medicare and Medicaid and Medicare Services, I believe is what it stands for. And basically the government healthcare administration came and reviewed her case, and they're like, whoa, wait a second, this is super fucked up. So they get involved, and she goes to court, right? So she gets involved in all of these legal proceedings and loses her license and all of these other things. And now, you know, after 3 years of legal stuff, we come to where we are now. Like, she thought it was basically settled because this happened. Vanderbilt negotiates an out-of-court settlement with Murphy's family. It requires him not to speak publicly. The settlement's not publicly known. And then they get tipped off about the error that they, being the authorities, get tipped off about exactly what happened. So what I kind of wanted to do is go through this step by step, because it seems like a very simple thing. Like, nurse does something catastrophically stupid, paralyzes a patient instead of sedating them, patient dies, there's a cover-up, and now she's getting indicted on criminal charges, right? So that's the gist. 3 years is a crazy amount of time, right? That's the US court system. Yeah, so all of this was hung up for a long-ass time. So we'll take this kind of step by step. So I actually ran across a decent description of what happened here on Reddit, because depending on where you look, there's a fair amount of, like, variance in the detail. But basically, it sounds like what happened is, so the patient's nurse was actually someone else, and they called the radiology team, like, wherever this patient was, this is Murphy, to, like, give them Versed. So Versed is a pretty questionable choice to begin with, and maybe this is kind of like a, you know, a minor point, but, like, old people, when you give them benzos, and Versed is a benzodiazepine, when you give them sedative medications, they get delirious pretty easily. And she was 75 years old and had a recent brain injury. So, like, that's sort of a recipe for making her fucking loopy. And that is something that you absolutely do not want in somebody who's going home after a brain injury like that, because you cloud their neurologic exam. Like, you can't do a proper neuro exam on her after she's had 2 milligrams of Versed. And you have a pretty damn high chance of, like, making her delirious. And then she can't go home anyway if she's actively delirious. Benzodiazepine, yeah, it's a class of drug. So like Valium or Ativan or lorazepam, or Ativan is lorazepam, clonazepam, that's what I'm thinking of. Those are all benzos, same class of drugs. They're basically like anxiolytics, like they calm you down. And in larger doses, they can make you amnestic, they can make you forget, which is actually what we use Versed for. 2 milligrams of Versed is a very common dose, because Versed comes in 2 milligram vials, and that will become important later. So it comes in these like little tiny, 2 mil vials, because it's 1 milligram per mil. But anyway, this is sort of a bad drug to use for her. There's lots of other options to begin with. But used to treat alcohol, yeah. So you can use it's a good seizure med. So it raises your seizure threshold dramatically. And patients who are in alcohol withdrawal are very prone to seizures. And so if they like start getting delirium tremens, the DTs, then you give them some benzos, either Versed or Ativan or something, to sort of calm that down while they're kind of coming off of their dependence. Reading about the CMS investigation documents, it looks like the docs didn't tell the medical examiner that she'd gotten Vec. Yeah, surprise. Surprise. Like, that's not something that they would test for. Vacuonium's a pretty rarely used drug, like I said. It wasn't in the medical record that she was given it, so the autopsy was done without knowing about it. Yeah. I mean, that's kind of what I assumed, because there's not any reason for them to test for a paralytic. Like, so whose fault is it? Well, we're getting to that, right? We're getting to that. That's what this whole thing is about. So, so radiology says no, we can't give Versed because we have to monitor them. Also important later. Okay, and that is totally accurate, right? Whenever you sedate a patient, you have to monitor them. And if you're using ASA standards, like American Society of Anesthesia standards, they need ASA monitors, which includes capnography. Like, you have to measure their end-tidal CO2, which most places cannot do. But lots of places, like, and by places I mean areas of the hospital, give Versed and fentanyl as what they call conscious sedation, because both of these can be reversed readily. So this is not super uncommon for people to get during procedures, but also the response is totally appropriate. So they called RaDonda, RaDonda Vaught is a fantastic name, by the way. Can we just appreciate how awesome this name is? Like, I really enjoy it. So anyway, they call her, and so at the time, this patient, from what I understand, was on what they call a step-down unit, which is kind of like halfway between the ICU and just somebody who's, relatively healthy, getting ready to leave the hospital. Entitled should be monitored, Vandy. Been doing that for 10 years in a smaller system with procedural sedation. Yeah, I agree. I totally agree. Yeah, 100% agree with that. But a lot of it is very common for places to give sedation without monitoring end-tidal CO2. It's a bad idea, but it does happen pretty often. So that in itself wouldn't make me like, cringe. That wouldn't freak me out. Kind of make me like sigh and do a Picard, but that doesn't freak me out. Hey, Dave, thanks, man. How's it going for you? Welcome. Good to see you. Appreciate that. Oh, happy Docs Day, by the way, to everybody else who is a physician in here. I got to celebrate mine by working, surprisingly enough. So anyway, RaDonda goes and gets this med, but she had to go to the ICU, which is a unit that she doesn't work on, to get Versed. That sort of surprises me. I would figure that a step-down unit would have Versed, because that's a pretty common sedative. And it does not surprise me, though, that they did not have Vacuonium. Happy talks data all the... Oh, you're such a bitch. You're such a dick. Oh, I love it. Don't forget the naturopaths. Yeah, happy Indie Day. Good shit. So yeah, anyway, she goes and gets this drug, and like I guess she goes to her Pyxis on the step down unit. Can't get it there because she's like, oh well, they don't stock it here. Goes down to the ICU, and cathopathic physicians. God. Oh, the doctorate of medical science thing, dude. That just kills me. It kills me on the inside so bad. I can't handle it. I cannot handle it. Shit. Oh man. So here's where the massive fuck ups begin, right? So she goes and picks up this med. So she goes and types in presumably VE into the Pyxis, which usually will in fact bring up the brand name, right? So apparently it did not this time though. So when you go into a Pyxis, I should back up a little bit. A Pyxis is basically a computerized locked drug cabinet that usually you have to sign into with like whatever, username and password plus like some sort of biometrics, like a fingerprint or whatever, handprint or something. So this is a very secure system for getting drugs out of, and you can in fact keep controlled drugs in it like Versed is. So she goes in, types in VE, and like snags Vacuonium. And it's my understanding that the Vanderbilt system, their Pyxis system in particular, is full of terrible, terrible, terrible extra alarms and warnings and shit that people are just used to like blasting through, because every medicine that you get out, like it warns you a bajillion times that you're taking something out. And like I can kind of relate to that because they are like Pyxis machines in general are fairly warning heavy. Like I get it. But when you're taking out things like Vacuonium, which is potentially fatal, it's like, hey, this is a paralytic. This is a paralyzing agent. Do you want to take this out? Are you sure? And so she just hammers yes. Just like hammers through all of this stuff. So goes and, gets ready to administer this medication to the patient. But wait, let's look at what a vial of Vacuonium looks like. Should have had this pulled up, but I didn't. So this is what it looks like. Right? It has this written on the top. Can you guys see that well? It says, warning, paralyzing agent in all caps, right? It says that in all caps. It's very, very obvious what's going on. And what's more is you can probably see here that this is opaque, right? Vacuonium, unlike most things, unlike just about every medicine that you'll pull out of a Pyxis, it's a powder. So you have to squirt saline into here. Okay, so you have to look at this. Like, unless somehow you can inject a needle into this area, which, like, in real life is a 1/16 of an inch wide, if you can put a needle in there without looking at it, then, man, you're pretty slick. You're way slicker than I am. And also, this is a 10 milligram and 10 mil vial. This is a 10 milliliter vial. So remember I mentioned that the 2 milligram dose of Versed was going to come into play? Yeah, this is a much bigger vial than Versed is. So like the size difference is obvious, the coloration is different. Hey, Lori Mae, what's going on? Vex should only be dispensed on a patient who's known to be on mechanical ventilation, otherwise only accessible by a physician. Yeah, I can't disagree with that. I mean, I don't see a time where you would ever, like... I mean, people don't really get on Vec drips, and if they did, you would have pharmacy do that. You would have them make that up. What surprises me is their med cabinet had paralytics just by themselves. Ours are only available in an RSI kit. Yes, I agree with that too. Yeah, it's a weird place to keep paralytics for sure. I don't know that it's like it's something that I disagree with, because patients do need, you know, from time to time, like if they just kind of get out of control and like start coughing on the vent or something, and there's, you know, they have a bronchospasm and their sats crash, like it's nice to be able to like get something out quickly without having to just pop an entire like intubation kit. But you know, it is surprising to me that this was so easily accessed. I personally have never seen anybody other than anesthesia use Vacuonium, ever. Why is Vacuonium as easy to access as normal saline? I don't know. I don't know. That's a good question. So in our Pyxuses, I can't speak for the Vandy Pyxus, but like there's a lot of warnings that get thrown up whenever you try to take a paralytic of any kind out. I'm gonna turn this down a little bit. Narcotic change of custody. Yeah, so narcotics a little different because they're controlled meds. And insulin requires 2 logins. Yeah, and insulin is kind of one of those things that there have been so many errors because of how it's packaged. So like for those of you who don't know, a lot of times insulin comes in little vials that are 100 units per mil. So if you inject somebody with 1 mil of insulin, or of, you know, that insulin, it's 100 units of insulin, which is a fucking lot. What are my wife's thoughts about this? She's, I'll just say she's more, militant about it than I am, and thinks that this was just an absolutely catastrophic and stupid error. And I don't blame her. Like, she's just like, how the fuck would you ever do this? And, you know, clearly a jury agrees that this was an egregious violation of, you know, common sense and, you know, fundamental standards of being a person. You're a PICU nurse and often see vials of Vec lying around the bedside unattended. Yeah, that's freaking dangerous and scary. I would never do that. The court evidence document said there were 4 warnings regarding paralytic just in the med cabinet. Yeah, I believe that. I believe that. I mean, it's fatal, you know? Like, you give this to somebody and don't monitor them, they die. And that's the next thing, right? So we were talking about monitoring a fair bit. So it's standard of care that anybody you sedate, you monitor. And, you know, whether or not you use end-tidal CO2 is, you know, like we were talking about, exactly how you monitor them is kind of variable, but shouldn't be variable, but it is. But RaDonda Vaught thought she gave Versed, so she should have been monitoring this patient anyway, right? But she, like, gives it and walks away. And nobody was watching this patient. So, I mean, even if she had stayed there, this patient would have been in, like, massively dire straits, right? Because they're getting paralyzed. But she would have had some lead time to at least deal with that. You know, maybe she could have, like, called the code or gotten somebody in there with a bag mask that could breathe for this patient while they figured out what the hell went on and, like, got her a breathing tube. But no, she just pushed it and walked away. So that is in massive violation of basically every care standard that I am aware of. And, you know, like we were saying, in addition to the warnings that she got in the actual, like, medicine cabinet, the Pyxus, like, look at this. It's a much bigger vial. It requires reconstitution. Doctor said the patient did not need to be monitored if just giving Versed. That's weird. That's unfortunate. This might be the same doctor that ordered Versed for a 75-year-old woman with a brain injury. So that's not ideal. But yeah, like there's a lot of failings here. And so one of the takes that I've seen, which is kind of disturbing, and I feel like it's Yeah, if they can blame it on one nurse, they don't have to spend money to change the system. Yeah, exactly. It was Vandy's hospital policy to monitor, regardless of what the doc said. Yeah, I mean, that makes sense, because that's like every sedation group's policy. And yeah, I mean, I agree that if they could just like make this her fault and have it go away, then they can be cool with their settlement and like everything moves on. But sort of the apologist take is that, you know, this wasn't her fault, and you know, people were telling her to do these things and the system failed her, and you know, like, I don't buy that at all. Really, I think the system failed as well. I mean, the fact that there's like massive alarm and warning fatigue at Vanderbilt is not helping. And, you know, the fact that Vandy basically covered this up, they paid the family off to hush, they didn't report it. You know, there's a doctor there telling her not to monitor the patient. Like, what the fuck is that? That's totally inappropriate. But what were her statements accounts? Because this is so insane. So she fessed up. She reported herself like immediately and apologized and talked to the family, and you know, to her credit, like basically handled this like post hoc about as well as you can. As I understand it. I think she reported the error promptly and you know, like, went about this as you should, you know, if you make an error like that. Which is good, but, you know, kind of the idea is that you don't, you know, negligently kill someone in the first place. So, like, I agree with the people who say that this is a systems problem, but I disagree that it was not her problem. Like, there are too many things that were just obvious. Like, the one that really gets me is you have to reconstitute Vec. Like, you can't give this unless you add saline to it, and there are medicines that you have to do that, but they never come out of the pharmacy that way. Like, it's like some antibiotics and stuff you have to reconstitute. I don't know, there's probably something else that I'm forgetting, but like, this is a very rare exception to like what generally goes on in a hospital. And like, just the fact, I mean, she's been a nurse for 2 years. Like, she probably has never given Vec. And I mean, like, I think I have used Vacuonium, like, as an anesthesiologist, I've used Vacuonium like under 10 times in my practice, and it was mostly because we had a shortage of other paralytics. Because it is a pain in the ass. Like, you have to get it out and you have to reconstitute it, and then it's just a hassle, dude. So, like, I don't understand how she could blast through that step and just be like, well, I guess this is what they want. Okay, here we go. She's holding this vial that's like much larger than a Versed vial, and Versed is actually light shielded too, so it's a brown bottle. It's a little brown vial. Like, basically as different from this as it could possibly be. And like, still this happened. And I mean, I guess I'm kind of preaching to the choir to a large extent, because clearly she got convicted of negligent homicide, but it just like, my mind is blown. I just don't know how this could happen. Like, it just, I can't even like process it. So, with that in mind, like, I wanted to kind of address the two main camps. Like, they need to make Vec the only drug that comes with a solid neon orange label. Well, I mean, I disagree with that, because you've got Rocuronium too, right? There's other paralytics. So, but Rocuronium, which is a more commonly used paralytic, also looks pretty similar to this, right? So you got bright orange, also has the paralyzing agent warning on the top, like, you know, lots of bright colors, flashing neon signs that tell you not to inject somebody with this because they will die if you if you do it. And again, like, this is not a super commonly used. Yeah, all paralytics should be labeled with a solid orange label. Yeah, I agree. And I think for the most part, honestly, they are. Yeah. So sucks, pretty much the same thing. So sucks, you might actually live if you get injected with this, because it lasts about 5 to 7 minutes. So if you've got healthy lungs, you might be okay. You might be okay if you get this, but that's you don't want to try it. But yeah, it's very very important that these are labeled as they are, right? They're all labeled very clearly that these are things that paralyze your patient. This, you can see there, has the same top that the others did, that Rock and Vec did. So I mean, it's very clear, and as Aranis said, the Pixis warned her multiple times that this was a paralyzing agent, appropriately so. And like these are it is scary to think about, right? It's very scary. Yeah, it is scary. And a lot of so where I was going earlier is the two main camps, like sort of alarmist camps who have come out of this. The one is people like, holy shit, I'm gonna die if I go to the hospital, right? So I want to dispel that pretty quickly here. So like, these errors get a ton of press and they're terrifying, but I can think of a grand total of 0 times in my career, including residency and practice, where somebody has been given a paralytic accidentally. Like, that has literally never happened. And we're talking probably 10,000 plus cases that I've been involved with or around in, the 10 years? Yeah, 10 years I've been doing this. Like, it just doesn't happen. That does not happen. And the vast majority of the time, when these drugs are even like out, somebody is getting artificially or like mechanically ventilated somehow. Like, whether it's a person breathing for them or a ventilator. Like, these drugs just don't even get taken out unless somebody's getting a breathing tube, or already has a breathing tube. So like, even if they were to get pushed inadvertently, like, at the very least, the team that needs to be there to like rescue them is there. It's like, it's all good. It's freaking scary for a little bit. You've seen and heard a ton of errors, including many involving paralytics, not just not in this form. Really? See, I have not. People get paralysis without sedation regularly? Oh my god, dude. That's so bad. I've never heard of that happening. I've never heard of that. That is so bad. So I've heard of people, like, getting paralysis with, kind of like low-grade sedation, like if they're already intubated and they start kind of waking up on the vent or something. I've seen people get paralyzed. I have deliberately paralyzed people for that because they gave themselves a bronchospasm basically by coughing up their tube. I'll stand by my point though that when these drugs are out, the vast majority of the time, somebody who can rescue you from that situation, to at least, like, maybe it's like a super unpleasant experience for you if you get intubated while you're basically awake and just paralyzed. Like, that's terrible, but at least you're not gonna die. So like, if you're in a situation where these drugs are available and out and ready to go, you're probably around people who can, manage that situation if you were to get them. But to like just inject them and walk away is like totally freaking unheard of. Especially, again, the fact that you have to reconstitute. But so medical errors happen for sure. Um, in my experience though, they're basically inconsequential most of the time. People actually are very durable. And like, if you give them the wrong dose of something, you pretty much just have to like watch them for a little bit and make sure that they don't have a giant adverse reaction. Like, even people who deliberately overdose on meds and take a shitload of something are generally fairly stable. I mean, it depends on what they take, obviously, and how much of it, but like we had one person like overdose on beta blockers, which is like metoprolol specifically, and they just kind of like sat in the ICU with really low heart rate for a while. Their blood pressure was pretty low, but that's kind of it. Is it true that medical errors are the... Oh, I figured I would get that question. So the question is it true that medical errors are one of the leading causes of death in the US? And the answer is a resounding no, absolutely not. So there's this really unfortunate study out of Hopkins, of all places, that is basically like just heinously badly put together, that stated that something like 300,000 to 400,000 deaths a year were caused by medical errors, and that is just not even remotely close to true. There are lots of articles about that. Let's see if I can find one real quick. There's a really good one that I remember reading about. But yeah, basically this is this massively half-assed, quote, research study. And it sucks that it came from Hopkins, because that, just the name power alone, led it tons of credence. And then all the ambulance chasers in the world latched onto it, and they're like, oh, medical errors, yeah, they're causing all these deaths. These doctors are just killing people. I'm just reading this real quick. So here, 2 of the most egregious misuses of misleading data are as follows. Doctors kill about 250,000 people in botched surgeries. Jesus Christ. This isn't the article that I was looking for, but I mean, it's just an example of how people took that and ran with it. And Dre, I would be very interested in hearing about some of the medical errors that you'd seen. Pretty big one back in 2014 where a nurse pushed up to 4 milligrams undiluted norepi. Yikes. That's real bad. That's not good either. Yeah, so norepinephrine comes in 4 milligram, or 4 milligram vials that you're supposed to basically inject in a 250cc bag to make a drip. So, that isn't good. Are you freaking serious? Go back, bitch. Alright, let's try that again. Hopkins, medical errors. Study refuted. Okay, fair enough. I know that's sort of a biased search, but that is, after all, what we're looking for. I think this might be the one. Yeah, this is a very good article that talks about that. Yeah, so basically it's just a really shit study, unfortunately. But yeah, so understandably a lot of people are really alarmed about this. And you know, the unfortunate truth is that it can happen to anybody, but it is exceptionally rare. Like, you've heard of this happening one time, and like I said, I've never seen this happen. Apparently Dre has, but which is scary. But there are, you know, nothing quite as egregious, but similar errors. And that is that makes me very scared. Oh, it looks like my bit rate's improving. But yeah, again, most medical errors are like pretty benign. You know, you watch somebody for a little bit, maybe they get like too much local anesthesia, or they get an extra pill of something. It's generally not a huge, like, functional problem. I mean, obviously it's a problem that somebody gets delivered the wrong medicines. Like, that's a you have to look at that and figure out why that happened. And most of the time that does occur. Like there's a, what do they call it? Root cause analysis? Yeah, there's like a root cause analysis, especially if some harm comes to somebody, like, maybe they incur an extra day in the ICU or something like that. Someone to monitor is there in the hospital to take on any adverse effects. Yeah, exactly. Let's see what we have here. I'm just gonna randomly follow links. Why not? Let's see what we got.
Meet Suvi, the magical all-in-one
Wrongful
countertop
conviction,
kitchen
10
robot.
reasons. Oh boy. Okay, well let's
Suvi
address
saves
this.
you time and lets you cook delicious meals for you or your whole family. The best part?
In this video, I'm going to give you 10 reasons why nurse RaDonda Vaught, the Tennessee nurse who made a tragic medication error that killed a patient, should not be convicted of reckless homicide. Hi everybody, I'm Bruce Lambert from How Communication Works. This is a channel where I teach you about communication skills so you can improve your relationships, succeed at work, and be more confident. When I'm not making YouTube videos, I'm a college professor, and my scientific specialty is medication safety, and my particular specialty is drug name confusion errors or wrong drug errors, which occur very frequently in health systems. I mention that just so you know why I should have any credibility in talking about a medication error case.
So before we get into this, I'm not going to watch this whole thing because it's 20 minutes. It's a long ass video. But one thing that you need to understand is that people in medicine generally have a very poor understanding of exactly how other specialties work. So, like, even this guy who apparently is like a safety expert, he doesn't. I am willing to bet that he does not understand like which Pyxuses have which meds in them, what exactly is involved in getting them out, and like who typically uses what, like why this is so egregious. Like when I first heard that she injected somebody with Vac, my first thought was like she had to fucking reconstitute that. Like, she had to like blast through a number of just safeguards to make that happen. So okay, well, let's see what we got.
RaDonda Vaught was a nurse at Vanderbilt University Medical Center in 2017 when she made a fatal medication error, confusing the drugs Vacuonium and Versed. Versed is a mild sedative, and Vacuonium is a paralyzing drug. She accidentally administered Vacuonium, the paralyzing drug, instead of Versed, the mild sedative, and as a result, the patient died. This all happened in December 2017, so there's a long history that leads up to the trial, which is going on now. And as I record this video at the moment, the trial has gone to the jury and we are awaiting a verdict. Shortly after I recorded this video, the news came out that the jury had returned a verdict and they had convicted RaDonda Vaught of criminally negligent homicide.
So I wish that he had this divided into sections so we could see what his reasons were as he talks. Maybe we could address those a little bit more efficiently.
So throughout the video, when I give reasons that I don't think she should be convicted, you can now interpret those as reasons I don't think she should have been convicted. And I'll make a final statement about this at the end of the video. The details of the case are complicated.
Double speed.
I'll go into as many of them as I need to make my arguments. But if you want the full details of what happened, I will link to articles in the description which give you complete information. Most of my argument in this video comes from an article written by the Institute for Safe Medication Practices, arguing that the Tennessee Board of Nursing's decision to strip RaDonda Vaught of her license was unjust. And it's the same sort of reasoning, I think, that leads one to believe that a conviction would also be unjust.
Oh, the jury doesn't understand how the Pyxus works either. That wasn't a jury of your peers. So that is something that we as healthcare providers, that's just a cross we bear. Unfortunately, you're not going to get a jury full of ICU nurses or, physicians and nurses and nurse practitioners and PAs and stuff. That's just never going to happen. And actually, an interesting story, my former boss dealt with, it was some emergency OB case, and I can't remember exactly what happened, but basically, it went to trial, and they got convicted or, judged against or whatever, and he got judgment levied against him, and he has a list, or had a list, of all of the jurors and their occupations, like, in his cabinet. He was a very, very vengeful gentleman. in case that wasn't clear. But like all of them were like tradesmen, basically. You know, there's like plumbers, electricians, you know, some like fast food workers, stuff like that, like judging this complex medical case, and that's just that sucks. That could be done much better, in my opinion. But you know, that's the legal climate that we live in, unfortunately. So, nah.
So very generally, what happened was, in December 17th, Nurse Vaught was taking care of a patient who was going to have a radiological procedure. The patient was anxious about the procedure, so they were going to give the patient a mild sedative to deal with the anxiety. Versed, or midazolam, is a mild sedative. Nurse Vaught went to retrieve the medication, Versed, from an automated dispensing cabinet. An automated dispensing cabinet is a machine that contains lots of different medications that nurses can use to retrieve these medications while they're working on the floor. This
Even taking any reasonable person standard, any reasonable ICU nurse should have caught that error and not given it. I mean, I totally agree. I agree.
particular machine was configured only to accept the generic name of medication. So in this case, the generic name was midazolam. So when she typed in VE, she did not retrieve Versed, but instead the drug Vacuonium, which also begins with VE. So she went ahead and dispensed this medication to herself, and it was a powder instead of being a liquid. Versed would have been a liquid.
Okay, so we've already talked about all this. Let's see where we're going here.
And
Wait, was that? Okay.
reason number 2, the prosecutors and the nursing board are not distinguishing between human error, at-risk behavior, and reckless behavior. In this
Is that the case? I don't know if that's true. I don't know that that's true. It's like the whole point of their argument was that she acted recklessly, right? I mean, that was like the whole crux of the conviction, as far as I
study of
was
human factors, human error, and human performance, there's an important distinction between human error, at-risk behavior, and reckless behavior. And only reckless behavior should be punished. Human error is an unintentional, unavoidable error in the way we act or perceive in the world. Human errors are not made by choice. Human errors in nursing involve things like transposing numbers in the dose of a medication, forgetting a particular step in the administration process, or making a mistake in programming an electronic infusion pump. These are called slips or lapses or execution errors. There's another kind of human error, which are planning or knowledge-based errors. A knowledge-based error would be when a patient is allergic to a certain class of medications, and then you give a patient a drug that's in that class because you didn't know this medication was a member of that class of drugs. There are internal and external factors that cause human errors. Internal factors are things like stress and fatigue. External factors are things like poorly designed systems, low staffing, glitching computers, and so on. Since all of us are vulnerable to human error and it's not done by choice, we shouldn't respond to human error with punishment. The traditional way of doing this in healthcare is called shame, blame, and train, and it doesn't work. Instead, we should focus on the system factors that put people in a position to make mistakes and try to make the system as safe as it can be.
Yeah, so this is a pretty common argument that I've seen, is that the system, you know, put her in a position to make this error, and I kind of partially agree with that, but like again, man, we looked at the vial of Vacuonium. It's like it's totally different. It's totally different than Versed. And then again, she gives it and just leaves. Like, she just leaves the patient. Like, had to reconstitute it, had to do all this shit, had to go out of her way to get it to begin with. Like, if you're unsure about something, just call pharmacy. Have pharmacy get it for you.
And also make it as resilient as it can be, because we know that inevitably some failures will occur. The second kind of behavior I wanted to talk about is at-risk behavior. At-risk behavior is the result of a choice. It occurs when people take routine sorts of shortcuts, mostly, because they've lost the perception of the risk. The most common example of this in healthcare is what's called the workaround. A workaround is a routine that doctors, nurses, pharmacists, and other healthcare professionals have developed in the ordinary course of their work to get around system glitches, delays, equipment failures, and the other aspects of the environment that just make their job hard to do. The vast majority of the time, these workarounds are safe, but occasionally workarounds, which intentionally circumvent safety procedures, lead to patients getting harmed. Again, years of research documents that workarounds are exceedingly common in all areas of healthcare. In every hospital, everywhere in the world, clinicians today are using workarounds. The most common kind of workaround would be to ignore computerized alerts.
It's not uncommon for computerized to be ignored 90% of the time. Yeah, I buy that.
That pop up when people are ordering medications. The important thing to recognize is that at-risk behaviors are often common and they're normalized. And also, most of the time, at-risk behaviors don't actually harm anyone. People
Alert fatigue and pop-up fatigue for sure. Yeah, and a lot of the times, like the alerts just aren't useful. You know, they'll warn you of some like. Well, an example that I can think of is we have order sets where we put in, you know, post-op orders for somebody, and we have multiple narcotics in there. You know, and that's just a thing we do in case like fentanyl doesn't work for somebody and they're having severe pain. We give them Dilaudid, and it gives you an alert that says you've ordered multiple narcotics. Oh my God, are you sure you want to do this? Please authorize, and you have to do that, and it's just kind of a pain in the ass because it's fine. It's fine that they have multiple narcotics. I would say most people in the hospital for something surgical have multiple narcotics ordered for them.
who engage in at-risk behaviors are trying to get the job done in the face of a variety of large and small system failures. And they're often rewarded for getting the job done fast, even though they're taking what are really risky workarounds. In a just culture, the correct response to at-risk behaviors is to first admit that they occur.
See, I'm
We have to
trying
be
to find
truthful and realistic that in any complex system like
signposting
healthcare, there will be workarounds that are used routinely, even though they are circumventing safety procedures. So first we have to admit that they occur, and then we have to try to fix the underlying systems such that the safe thing to do is the easiest, quickest thing to do. And then you have to coach people and reward people for doing things the safe way, doing things the right way, and not punish them.
So that's basically impossible. To make the safe way to do things the quickest way, that's just never going to happen. Safe medicine is generally conservative medicine, and doing conservative things basically takes extra steps, and that's fine. But and you can streamline and, make those processes better, but those, like, the fastest and the safest things are never going to be the same thing. Like, basically ever.
For, say, taking a long time because they're doing things the right way. The third category of behavior is reckless behavior, and this involves consciously disregarding an unacceptable and unjustifiable risk. People acting recklessly know that they're taking an unacceptable risk. They don't think...
Bot might have pushed your message out of the link view. Oh, yeah, I think it did. Bummer. Need a generational translation for millennials and Gen Z? Perhaps. Perhaps. Such a thing as a diabetic attack? I mean, not really. Like, you can be in diabetic ketoacidosis, but that's hardly an attack. That takes a little bit to wind up to. Let's see if I can raise the restream chat here. What do we get from Lori? Highlight that again. Yeah, this guy I don't really agree with. I would watch more of that video, but 20 minutes is kind of excruciating. 3 minutes we can do. I mean, I don't think we really need to
alert fatigue may be
watch this whole thing, though.
The most kind of clear and present danger of computerization that we've seen in terms of its impact on patient safety. In the book, I tell a story of a kid at my place who we gave a 39-fold overdose of a common antibiotic to. And the initial error...
Oh, that must be the story that, Uranus, you mentioned in Discord.
Was just a simple glitch. The doctor didn't realize the screen was on milligrams per kilogram rather than milligrams. It happens. But what was really remarkable was an alert fired to the doctor and said that this is an overdose. The doctor clicked out of it. An alert fired to the pharmacist. The pharmacist clicked out of it. And you might, as an outsider, say, oh, how could they be so careless to do that, until you realize that in a month at UCSF, at my institution, the doctors get 30,000 alerts. The pharmacists get 160,000
Holy
alerts.
Shit.
And those are just the computerized pop-up boxes. In a month, in our 70 intensive care units, the computers that record your heart rate and your blood pressure.
You don't want that to be... oh, that's not the EKG. That's... You don't want that to be your capnography either, though. That looks really bad.
Your oxygen level, they throw off 2.5 million alerts, to the point that there's an audible alert every 6 or 7 minutes. And one of the nurses who was interviewed for the book was asked, how would you know to be scared about a patient? The alerts are going off every 2 seconds. And the nurse said, silence. If there were no alarms going off, then I'd be really worried. I mean, think about how crazy that is. But we have not yet sort of maturely thought about this issue of alerts. We have this idea that, sure, if these two drugs might interact with each other, we'll fire off an alert and then leave it up to the doctor or the nurse to deal with it. That shows no understanding of human factors and user-centered design. What do we have to do? We have to go through each of the alerts, this is pretty painstaking, and say, this particular alert appears, every time it pops up, people click out of it. If that's the case, we need to get rid of it. Because I think we've approached alerts as being if they're...
Yeah, so I mean, I agree with what this guy's saying. Like, it's easy to just see the alerts as spam, basically, and move on. Because most of the time, they are, honestly. I'm going to bring that up again. Yep. So it's interesting that ZDogMD took the sort of apologist position. I haven't watched his take on it. I guess I probably should have. I should have anticipated that he would have addressed this by now, but I don't know who Nurse Blake is. But yeah, most of the people taking this, it's the system, approach are in fact nurses. And I think a lot of that is they fear prosecution, frankly. Like, it is... Ooh, here we go. I'll get back to that thought in a second. So one of Dre's cases, one thing you had was an EGD that was crashing. GI hit a bleeder, intubated emergently. GI left the building, so you got a report from CRNA. Okay. Couldn't control his BP. The assumption was he was clamping down from the blood loss. That seems a little weird. Pushing paralytics for 1.5 hours with no sedation. Yeah, so that sucks. That sounds like basically a mismanagement of trauma, honestly. A very common thing to do with somebody who is like massively circling the drain is to just straight up paralyze them. Like you give them no anesthetic, you just paralyze them. Because if you do sedate them at all, then they could be crashing more. Because a lot of times, like pain or fear or something is actually helping their pressure stay up if they're conscious enough to have those reactions, which a lot of times they're not. I'm not saying that this is like good, but he'd been listening to doctors scream and freak out that he was going to die for almost 2 hours. Fuck, man, that's really bad. That is really bad. But yeah, like you quickly graduate from that. Like, if you need them paralyzed for whatever reason, I mean, like, within minutes, you give them, like, a huge dose of Ativan or something that makes them amnestic for, the foreseeable future. So they screwed that up pretty hard. That sucks. That sucks for that guy. Nurses catch errors that doctors are about to make all the time, but there's no one to protect the nurses. With that kind of liability, obviously nurses' pay needs to be higher. I agree with you that nursing pay needs to be higher. I don't know if it's for that reason necessarily. Yeah, nursing, like, I did a whole video on this. Like, if you want to check out my YouTube, actually, I did a whole video on how nurses are just getting totally railroaded. And, like, why travel nursing is such a epidemic these days. But yeah, totally agree with you there. Nurses are like critically underpaid. As for the liability thing, I think that's just sort of a natural. Do I think doctors need higher pay? Fuck yeah, I do. I think everybody in healthcare does. We are all massively underpaid, especially primary care. Yeah. Issue with RaDonda, she did everything right after she screwed up, and she's still going to jail. Yeah, I mean, yeah, it's hard for me to be super sympathetic for that. I mean, she didn't dig her own hole deeper, but dude, she still made an absolutely terrible, egregious error. Like multiple of them, to actually inject this patient with the drug. And that sucks. Like, but she's not getting charged with like, I think so. I think they're 100% putting her behind bars. I mean, the two things that she's convicted of carry a total potential sentence of like 10 years, I think. And I mean, they'll probably be pretty lenient on her, honestly. Liability equals pay logic. Paramedics shouldn't be getting 30K a year average. You don't have a Pyxis or anything to manage your meds. It's just one vials. And yeah. Yep. Nobody else's, no Pyxis or systems issues to blame. Yeah. It's, yeah, I don't know that that's a solid argument in my mind. Like, honestly, I feel like somebody who... So here's a hot take. I actually think that criminalizing negligence on this scale is going to be kind of low, very, very low level good for healthcare. It directly speaks to us to cover up our mistakes instead of being involved in QI. I mean, does it though? I don't know. I don't know that it does. I mean, errors like this don't happen all that often. Especially that result in patient harm. So I don't think that would be the case. I mean, and who's to say that if she had covered this up and hadn't been honest, like, she would have gotten a much harsher sentence. I am not legally savvy enough to say, but that may well be the case. This is how we keep your beds in the ambulance. Yeah, that's pretty common. Like, especially in smaller hospital settings, like, this is how you get your narcs. They're just in a locked box that you kind of like ferry back and forth from pharmacy. Yeah, it's pretty ghetto sometimes. But I mean, so physicians are responsible, like, on a criminal level for gross negligence as well. I mean, that's nothing new. I don't really see why. If only she'd been a neurosurgeon, we'd be covering up for a decade. Yeah, Dr. Death, right? Dr. Death is a great example of this. And the problem is, well, in my opinion at least, the problem is that doctors make hospitals way more money than nurses do, especially surgeons. So, like, you're a spine surgeon, you're bringing in millions of dollars. You're bringing in tons of cash to the hospital, so they have a lot more incentive to, sweep that under the rug. And Vandy did exactly that, right? They paid the family hush money and, made this go away, and the family was satisfied from all accounts that I read. Like, they were happy. What kind of surgeon? He was a neurosurgeon. Dr. Death was a neurosurgeon, and he, you should Google Dr. Death, dude. You want to talk about terrifying. Like, that guy eclipses RaDonda Vaught by several times. I mean, he, like, paralyzed his best friend by doing a, like, neck operation. Yeah, Jack the Ripper vibes, hardcore. Yeah, he is a twisted, crazy motherfucker, man. That guy, he needs to be put away, for sure. What kind of surgeons bring in millions? Probably most of them, honestly. Maybe, like, a not busy general surgeon wouldn't, but, like, orthopedics does, neurosurgery does. Gynecology may not, but they're probably close. Sounds like it should be a movie. It's a series. I think there's a Netflix series on it, or some subscription service. You need more milk, Levo. What's up, man? How are you? Yeah, the high education and training will garner high compensation. Yeah, I mean, like, just the surgeon salary alone is like $1 million for, a busy neurosurgeon. But yeah, I mean, I think the thing that nurses are very alarmed about is this is like, it is an interesting precedent for them, right? She did everything correct. We threw her under the bus. Yeah, I mean, did we throw her under the bus though? Like, I mean, in my opinion, she's just kind of like getting, I mean, she's convicted of doing what she did. Like, yeah, she's honest about it, but, we have other precedents for that in the legal system. Like, if you admit to running over a family because you were texting or something, you're like, oh my god, I'm so sorry, I ran over your kid. Like, you still killed their kid, man. Like, doing something irresponsible. And I mean, Dr. Death's, yeah, the Dr. Death is, like, way more fucked up than this. There's no question. Like, that situation is just unconscionable. No milk, only propofol. That is my milk. Yeah, I don't know who the anonymous tip-off came from. I mean, I guess Vandy organized that. That's a reasonable conclusion, I suppose. No, I don't think the patient's family didn't sue her. The patient's family, from what I understand, was, like, totally cool with it. I mean, not totally cool with it, but they were understanding, and she apologized to him, and everything was fine on their front, as I gather it. Again, the accounts of this are, there's a fair amount of, like, editorializing in a lot of the articles that I read, so it's sort of tough to get a concrete read on it. Yeah, State Canon did still sue. Yep. But yeah, I don't know. Um, I don't see Vandy's motivation to tip off anybody. Like, because it seems to me, like, from what I've read, it seems like the issue was kind of settled. Right? And it's really the anonymous tip-off that got the whole, like, state and government prosecution ball rolling. And why they would attract that kind of attention, I'm not sure. So, we'll go back to this timeline here. So, they'd already settled in early 18, right? Settlement's not publicly known. Vaught's working for a while, and then, what, like, 6-ish months later, they, you know, the feds get tipped off. So I don't see it. I don't see the motivation there, right? Like 6 months is freaking forever for something like this. Read the anonymous complaint about the fatal error. All right. Let's do that. So somebody at Vandy did it, clearly. Is the area without a no-talk zone designated sign? What the fuck is a no-talk zone? Medication IV, flushed after. She did not check the doctor's orders, follow the 5 rights of medication administration, administered drug outside her scope of practice, yes. Failed to properly monitor the patient after administering medication. You can't talk within the zone, I guess not. Is it like the cone of shame? She was inside the cone of shame. I do not like the cone of shame. Yeah, so I mean, if there's maybe something that I don't know about this, like maybe the feds were already kind of like poking around or something, and they like Vandy admins decided to like act on this and like create a scapegoat. I don't know, maybe. I can see a world where that's possible. Yeah, I don't know. How can the state sue, and why would they sue? That's you're punching out on my expertise there, man. I am not a lawyer. I would imagine that it has something to do with the fact that they like the institution receives state funding, and you know they're like not meeting standards. Maybe as a way to prevent nurses from trying to go for the whole traveling thing in a weird public way. I mean, yeah, maybe. Maybe. That seems awfully risky though, right? Like look at all of the terrible press that Vanderbilt's getting right now. Like that's a big risk. Big risk to take. So I don't know. Like that's actually one thing that I wanted to cover is I don't see the motivation for them to throw her under the bus after this had kind of like been settled, right? So again, maybe there's some things going on behind the scenes that we don't know about. There's like CMS is always inspecting stuff, so maybe they like audited Charlene Murphy's chart. Who knows? Who knows what's up? What happened with Vanderbilt? Oh, dude. Here, read this. Basically, a nurse injected somebody with a paralytic and they died. And she just got convicted of, uh, I've forgotten exactly what it is. Negligent homicide? Reckless homicide. And then also, like, abuse of an incapacitated person or something. Lost their license, it should have, but the question of reckless homicide, and if anyone was served by pursuing that is different. Yeah, that's RaDonda Vaught. Oh, God. Too soon, man. Too soon. Too soon. Yeah, question of reckless homicide, and if anyone was served by pursuing that is a little different. I mean, is anyone ever really served by pursuing homicide charges? I mean, like, maybe there's, like, vengeful families or something who, like, want justice. Well, while hers wasn't. Okay. State sue in criminal court for violation of state laws. Private citizens sue in civil court for damages. Okay, fair enough. There you go. Yeah, I mean, so I should say this. I am surprised that this went to a criminal proceeding. I am fairly, like, especially on that level. I'm surprised that she got a reckless homicide charge. I figured that something, like, if she were to go face criminal charges, that it would be something lesser. We talked briefly about the 14-year-old kid that passed away after slipping out of a roller coaster seat? What? I know nothing about that. Uh, 14 roller coaster. Shit, okay. Oh, wow. Was it this? The drop tower? Okay. Person falls from their seat. Oh my god, somebody was videoing this? Oh shit. Alright, so you want to talk about weird regulations. Apparently theme parks are essentially unregulated. Like, they, at least in Kansas and probably Missouri. So you guys may recall several years ago when a 10-year-old kid got basically decapitated on a water slide. That was here in Kansas City. That was at oh shit, what was that place called? Schlitterbahn. That was at Schlitterbahn here in Kansas City. We like, just coincidentally, my wife and I watched a video on the making of the slide that he died on, and like, it's the most absurd thing. Like, we watched this like a week before this incident happened, like, just totally coincidentally. But the way they were making the slide, like, so the slide is like, well, you can actually see it here. This is it. So it goes down, and then there's like a bump where you like catch some air at the top, and then it, you know, goes back down. So it's like, it goes like this, and then goes down. Hey, Dr. Cheezel, what's going on, dude? So, like, when they're making this, basically, like, the way they calculated it, it was just launching the slides off. Yeah, you shouldn't go on that ride because it freaking kills people. So, when they first engineered it, it was just launching slides off this ramp. Just, like, totally launching them. And so they, like, this is in this video, the, like, making of. So, in the video, they're like, okay, well, I guess we need to, you know, make this a little higher so, you know, it doesn't launch the slide. And they, like, adjusted it once, and it's still launching slides. They adjusted it again, still launching slides. And then they adjusted it a third time, and we're like, yeah, that'll be fine. And then they built it. They didn't test it the last time. It's like, what the fuck, man? About to update some charts. That sounds terrible. Yeah, that's a terrible situation, right? But yeah, like, they're just unregulated. They just are like, basically self-reporting to the state that, like, everything's okay. So yeah, amusement parks are super fucking sketchy. And I'm kind of like afraid of heights and not a super huge fan of like amusement rides and stuff. And after I watched that video, I was like, nah, I'm good. I'm good. Well, Dr. Cheezel, I am interested to hear what you think about this RaDonda Vaught case. I'm sure you've heard of it, but it was fine for a few years until it wasn't, until they knocked off a child's head. Whoops. Maximum recommended weight was 286. The teen weighed 340? Oh, shit. Wow. Damn, that's freaking scary. Apparently, seat belts were not checked perfect. What could go wrong, right? What could go wrong? Which case, RaDonda Vaught, she was the Vandy nurse that paralyzed somebody with Vec and walked away, and they died. I don't know. I assumed you'd heard about it, but I suppose not everybody has. But yeah, we pretty much worked our way through it, but we're just kind of talking about, like, why exactly she got charged with reckless homicide. Which I can't say I, like, entirely disagree with. So, as for the precedent that it sets, like I mentioned earlier, I don't really see it as entirely a bad thing. I mean, if people in healthcare make mistakes that are, yeah, super nuts, right? Like, if you push through to make a dangerous error, despite multiple warnings, and, like, you violate care standards, and all sorts of things like that, did the medicine get swapped? No, she just took the wrong thing out of the Pyxis. Or the like, medicine cabinet. And administered it, and it's super fucked up, because, like, we covered this earlier, but the part that blows my mind about this is that Vacuonium comes in a powder, so you have to mix it with saline before you give it. And that's, like, nothing else fits that. There isn't anything else that you would get out of a Pyxis that fits that criteria, really. With the possible exception of antibiotics. But, I mean, there's so many, like, critical errors that she had to make to, like, actually, like, even, like, administer the medicine. But the thing that makes me think about it, and, like, Dr. Death was an example that we brought up of somebody who, like, totally deserves to be, you know, brought up on criminal charges, but, like, not, you know, being the legal dunce that I am, the problem is, like, where's the slippery slope end, you know? The harshness of the verdict was a little on the nose. Yeah. No, I agree. I think it's pretty intense. Especially given how she handled herself. Like, I don't think just the fact that she got, you know, a criminal indictment out of it is necessarily a bad thing, but it is pretty hardcore that she got a murder charge for it, or reckless homicide. I am sort of still processing how I feel about that. I think it's probably a little over the top, but I see why the jury sided on that. But, you know, again, this was not a jury of her peers, truly. As we discussed, I'm sure there were not too many healthcare providers on that jury. But I do think it's a decent precedent to set for, you know, basically just, like, insanely egregious medical errors. I don't see that there's anything wrong with not protecting those people from legal problems. Like, ideally, in a perfect world, that would actually, you know, incentivize people to check what they're doing a little bit better. But, you know, now that I'm saying that, at the same time, like, errors like that are just so freaking rare that... So do nurses not have medical malpractice insurance? I honestly don't know the answer to that. I'm not sure. Drake could probably answer that for you better than I could. I know some do. They're supposed to. Okay. Yeah, I don't know if that's something that just sort of, like, gets covered by whomever they're working for or what, but it would certainly make sense to me that they would. Like, we had to get, for my business, we had to get malpractice insurance for the nurses. Like, for the company so that nurses could work. You have malpractice as an EMT? Yeah, makes sense. I mean, it makes sense to me. I know nothing about nursing contracts. But so, I mean, on the flip side, right? Like, if you consider the alternative, like, it seems a little fucking crazy that malpractice insurance would cover like everything that you do wrong, right? Even if it's like not intentional, like even if there's no intent and you just like screw up and create a bloodbath in your wake, that why is that not criminal? Varies from state to state. You won't get sued unless you have a policy lawyers can go after. Yeah, I mean, shout out to first responders. Absolutely. Absolutely, man. That's been a very tough row to hoe for the last couple years. I mean, it always is, but especially. Lawyers don't take the case unless there's cash to be had. Yeah. Yeah, I mean that's totally true, right? Like doctors and hospitals are much juicier targets than nurses and EMTs, generally speaking. Even though, as we discussed in the previous stream, my net worth is zero. It's less than zero right now. but people don't know that. So yeah, it's a sticky situation, and I wish I knew more law. Like I wish I knew more healthcare law to really understand like what the alternatives were here. Like were there other things that she could have been charged with besides reckless homicide that would have like kind of fit the situation? I don't know. Just become a lawyer. Yeah, no problem. That seems like a great use of my time and money. That seems perfect. My potential future earnings could be garnished. True, true. So bring it on the lawsuits. Let's go, guys. I got money for days. Oh, thanks for the bits, man. Do I have to do a jurisprudence course every certain years? I don't think so, actually. I did to get my license, um, like in the first place, but I don't like as long as you just renew the license. I don't think you do. Bits for JD. That's awesome. Good. I didn't get it, but now I understand. That's fantastic. Should be checks and balances that this kind of thing shouldn't happen. You have to take one every 4 years to renew your EMT license. Yeah, I mean maybe we do, and I'm just like not remembering it. I really don't think so though. Like I had to take a pretty long jurisprudence test to I think it was like 40 or 50 questions that I had to read this like giant piece of legal writing for Missouri. I can't remember what Kansas's was. It was much shorter than that though. Don't think there was any intention behind what happened. Oh yeah, for sure. I mean, I think she just like legit made a careless mistake. But that's some pretty extreme carelessness. Like, hot damn. Legal docs are retarded. I agree, dude. I mean, I have to wonder like how much of them even lawyers read, like lawyers and judges. It's they're just so painful and there's so much just words. So many words. Is that something that people actually like delve into? I don't know. Oh, are you talking about like docs like MDJDs? Well, I am seniors as an MDJD. Yeah, I mean like it's really unless you're like specifically going into healthcare law, that doesn't really make a lot of sense. Or you're gonna try to be like a big ass hospital admin or something. I guess that'd be helpful. Goals. Hashtag goals. Yeah. I mean that's so much training, dude. Jesus. Yeah, I don't like those professions overlap very badly. So you have to like specifically set out to use both of them basically to make that worthwhile. I mean, in a lot of ways, it's kind of like an MD PhD. Like if you're not doing high level research, why why would you do that? But it's even worse than that, I think, because they're so unrelated. Yeah. All right. So what did we want to? Are there any MD, JD, PhDs? I'm sure that's happened at some point. There are lots of crazy ass people who just are in school forever. But that is just like that's beyond nuts. Right here, yeah, Levo. Johnny Kim? Oh no. Now I have to Google it. There were more pages on the Instagram post you linked? Oh, okay. Where did that go? Oh, I think I closed it. Shit. Can you repost it? Sorry. TOMD, EMT, DDS. Perfect. Physician and NASA astronaut. Jesus Christ, man. My dick suddenly feels very small. More pages on this? Am I just like missing it? Oh, yeah, here. Duh. Alright. Precepting a new hire RN while acting as a resource nurse. This is RaDonda Vaught? Okay. With your scanty 4 degrees. The possum is cute. No, he's not. That thing is scary as shit, dude. What are you talking about? It's gonna kill you. It's gonna rip your freaking neck open. Okay, I do not know how far along this orientee was, so that does play into how busy or overwhelmed she was. She was asked to pull Versed on a patient that wasn't hers. This patient was going to a PET scan for a routine scan of the brain. What the fuck? Yeah, we covered that earlier. That doesn't make any sense to me. But anyway, it was not an emergent situation. There's no need to rush. The order not crossed over from the AMR. She overrode it. Medications are accessed by their generic name. Versed is midazolam. Yes, it is. ADM then gave her a series of 4 pop-ups that she was pulling a paralytic. That was for emergency use only. Vec is not something that I would use in an emergency, just for the record, because it takes like 2 minutes to start working. After pulling medication, she popped the cap off the vial. Yeah, we looked at the vial, right? We looked at the vial of Vacuonium and saw exactly this, right? So there's tons of, just like in nature, shit that's brightly colored you don't want to touch or fuck with because it's poisonous, right? The Vec vial is the same way. It's important to note here that there's a profound difference between Vacuonium and Versed. Yes it is. Yes, there is. Versed's a liquid, Vec is a powder. Okay. Has to look directly at the red ring, warning her that this drug will paralyze the patient. Yep. She administered without scanning it. Okay. I missed that part, but that's bad. No blue frogs for you. But fruit is brightly colored? Maybe you're just poisoning yourself all the time. Right patient, right minute, yeah, blah, blah, blah. Uh-oh, fruit poison. Patient was then sent to radiology without being monitored. Oh, so she got the Vec before she went to radiology. That sucks. So she got transported while she was paralyzed, and nobody noticed this? What the fuck? Okay. Which is not the standard of care for an ICU patient. Yeah, no joke. especially if one wasn't on a sedative. In this case, the reasonable person is amended slightly to a reasonable ICU nurse. What would a reasonable ICU nurse have done what RaDonda Vaught did? So, I would say this would be yes. Would a reasonable ICU nurse have overridden a non-critical medication for a routine medication that had not crossed over to the ADM? Yes, that happens all the time. Would a reasonable ICU nurse have overridden 4 pop-up warnings that the medication she was pulling was a paralytic and not only to be given in emergency? Maybe. Possibly. If it's got that many warnings, then yeah, possibly. But still, to not notice that any of them said it was a paralytic, that's pretty rough. And this is, like I said, this is the one that really blows my mind. Would she have continued to reconstitute a medication that she knew was not reconstituted? So, yeah, like, again, nothing else requires that, really. Would a reasonable ICU nurse have looked at a medication file that said warning paralytic agent and continued to give it on a non-ventilated patient? No, not at all. Would a reasonable ICU nurse have given a sedative to a patient and sent them to radiology unmonitored and unescorted by an RN? No. What was the thing she actually needed to administer? Versed, which is midazolam, or a sedative, mild sedative. Which, as we discussed earlier, is actually a pretty bad choice for this patient because she was old and had had a recent brain bleed and was, like, at very high risk for being delirious from that. It's obvious when you correctly apply the reasonable person standard she was criminally negligent. Importantly, there is no intent element in negligence. So that's interesting. I don't know anything about legality. This means that whether or not she meant to harm or kill the patient is irrelevant. It's also important to note that this is not a staffing issue nor a fatigue issue. In her statement to the TBI, she said that neuro-ICU was always well-staffed due to patient acuity and that she was well-rested. Certainly Vanderbilt set her up to fail. Much has come out about Vanderbilt sweeping this under the rug until CMS was alerted to the error by an anonymous tipster. And the Tennessee Department of Health's conflicting response regarding Vaught's nursing license. Did the attending make any comments on this? Not that I'm aware of, actually. Not that I'm aware of. If somebody knows different, that would be awesome to talk about, actually. But Vanderbilt's failures do not absolve Vaught of her culpability in this matter. Independent of the systemic issues we all face as healthcare workers, she made decisions and ignored what warning signs remained. Somewhere down the line, we as nurses got it into our heads that just culture meant we could do whatever we wanted with no consequences. This was never the case. There's still laws we are subject to. It's not simply a medication error. She didn't give 5,000 units of sub-Q heparin IV. She didn't fat finger an Alaris pump. One last personal anecdote because it's relevant. Okay, hang on. Multiple instances of ignoring built-in safety checks as she rushed a routine procedure. If at any moment she had paused long enough to reassess why this time was different than all the other times she'd given Versed before, which was probably a lot, because that's a very commonly used medicine, the patient would not have been harmed. I agree with that. Vanderbilt's gonna lose some credibility after all this? Yeah, 100%. For sure. Yeah, definitely. Definitely gonna take a huge hit from this. And my concern is that healthcare in general loses a lot of credibility from this. Which I think, damage is done, right? But I'm trying to do my part to dispel that. But it's, if the pandemic has taught us anything, healthcare providers are not really very well trusted to begin with. So people are going to take any opportunity they can to, stab us in the back. Let's see. 2 weeks ago, sweet old lady your family knows fell and hit her head with a brain bleed. She went to hospice and died with family. She had dementia and a good long life, so that's a happy ending. Well, dude, hospice is amazing, by the way. Your nephew who knew her and is a gamer obsessed with Fortnite. He was told she died and asked how she died. I told her she fell and hit her head. He says without pause, oh no, she died to fall damage. Oh no. Oh no. I'm sorry, I shouldn't laugh. Oh no. Oh god. That's too good. Oh man. Well, that's wow. I feel like a terrible person. I feel very bad for laughing at that, but let's see. Will it be easier to get into their medical program and not only accept those with 3 9s and 5 16s? Yeah, maybe so. Who knows, man? Med school is just nuts. You feel so guilty, but you laughed, yeah. That's pretty fucking funny. You told the lady's family? That was ballsy. Jesus. Wow. You must know them very well. That's crazy, man. You must know them extremely well, and they must have a very good sense of humor about that situation as well. Alright, I'm gonna finish this up. I've seen a lot of nurses and some physicians react with righteous indignation that a prosecutor would charge a nurse for a simple medication error, or that it was a miscarriage of justice that a jury convicted Vaught of criminally negligent homicide, that it was solely Vanderbilt to blame for setting her up to fail. I think that's bullshit. Vanderbilt screwed up royally, but so did Vaught. We can simultaneously hold the system responsible and ourselves. Yeah, I agree. To quote the most excellent nursing meme page, Thirst Responders, we should be open to the idea that she was negligent instead of blindly defending each other when we're wrong. For dementia patients that are like 90, should you put up baby gates to make sure they can't go up and down the stairs? No, because they're gonna fall over those gates. Like, 100% gonna fall. This is a really good link, Aranos. Thank you for providing that, by the way. So, we, in, like, our first year of med school, when we were learning how to take, like, history and physicals and stuff, one of the things that we had to do was, like, evaluate an old person for, like, safety of their home. And you have to ask them all sorts of ridiculous shit, like, do they have a stove that has some sort of, auto turn-off function, or do they have carpeting in their house that they could fall over? Do they have, you know, stairs in their house or something like that? And things like that are why I don't do primary care, because that drives me nuts, and I don't want to worry about that. But yeah, old people with dementia take basically every opportunity to injure themselves. Like, whenever there's an ice storm, dude, I swear to God, that's when Grandpa Fred decides it's a good idea to walk the dog. It's a little yikes if you want to get into Vanderbilt. Hey, brother, I had a 3-1. Low GPA club, yay! Just applying everywhere and happy with just about anywhere? Yeah, dude. You want to apply to DO schools too, by the way. Despite what the most recent match held for them. That was rough. That was a rough match, dude. But I feel like I'm not listening to... Yeah, oh boy. Like, this whole VOD's gonna get muted because it's all... It's not DMCA safe. Bummer. Let's play this. Definitely applying DO. Perfect. How much more difficult is it to get into competitive specialties as DO? Significantly. Yeah, it's quite a bit more difficult. If this year's match is any indication. It was a rough match, dude. It was a very rough match. Like, I think I can't remember any numbers. We looked at it earlier, but man, it was not fun. Not fun for most people. Could match be affected due to COVID at all? I don't know. I think people were like freer to apply more places because of remote interviews. So you could potentially like go on more interviews, you know? You went down into your list of ways. Hey, at least you matched though, dude. At least you matched. Congratulations on that, by the way. I forgot to, like, I remember you mentioned that you matched, but I don't think you ever said where you did. And obviously you don't have to, because that might be identifying, but in any event. I think interviews will still be virtual in 4 years. I don't know. Maybe. It's certainly a lot more cost-effective for the programs. But yeah, I mean, I think a lot of the problem people had was, like, programs just don't understand what to do with that volume of applications. You know, they're not used to having to vet people, you know, whom they can't, like, see face to face. Because, like, presumably if you're willing to travel somewhere for an interview, you're at least, like, kind of interested in going there, right? You know, you've paid for your plane ticket and your lodging and stuff, and you have some sort of vested interest in going to that program. But if all you have to do is, like, you know, put on a suit coat and sit in front of your computer screen, then, you know, the bar to entry is pretty low for interviews. So it's sort of tough for them to tell, like, who actually gives a crap about their program. So, and I bet you that factored into the last couple years of matching pretty heavily, actually. Yeah, I mean, like, for me, I went on a lot of interviews compared to most people. I think I did, like, 17 interviews. And, that, like, I had to do some pretty crazy scheduling gymnastics to, make that work. But now, you know, you can pretty much do as many as you want, you know, as long as you've got the day free. It doesn't really matter. Imagine spending hundreds of dollars to go to an interview just to be rejected. Yeah, that's sort of how the game works, dude. Unfortunately. Yeah, I think I spent like probably $5 grand on interviews or so. Maybe a little bit less than that. I saved a lot of money by like couch surfing and grouping interviews and stuff. That's my dating life. Zing. Good academic place about 4 hours north of you. Okay. Cool, man. Well, I'm glad you matched a place that you were happy with. Saving up in gap years to afford med apps. Yeah. Fuck, man. It's such a bad deal. So bad. Well, gentlemen, I think I probably ought to call it a night. It's a good talk. It's a good talk. I'm gonna see if what I can do about removing the the non-DMCA protected music from the stream, so I can actually like edit this into a useful YouTube video. But that may not happen. Do I identify as obese? I mean, I guess I have no choice now, right? The calculator says I'm obese, so I must be obese. All right, well, thank you everybody for coming by. That was really good. That was fun. It was a good time. Hopefully, we all learned a little bit. I know I did. Kind of thinking through the situation and whatnot. So, for those of you who are not regulars of the stream, I'm Milkman Al. Please join me on Wednesdays and Sundays, 8 to 10 p.m. Central. Usually there's some gaming going on, but tonight we're talking about something pretty important. So, hopefully you enjoyed this. I'll be playing some Last Epoch on Sunday, so come check it out. Hope you guys had fun, and I'm out. Have a great night.